The big focus this evening, the H3N2 outbreak is raising concerns across India. In the past few weeks, ICU admissions have risen because of the influenza infection. 2 deaths have already been attributed to H3N2, one each in Karnataka and Haryana. Fresh reports are indicating that 2 more deaths have occurred in Maharashtra that could be attributed to the virus. A total of 352 cases have been reported in the state. The Health Minister of Maharashtra is saying that H3N2 is not fatal and can be cured with medical treatment. He also said that the deceased patients had other existing medical conditions. The Union Health Ministry is also monitoring the outbreak. Many states have released advisories to stay ahead of the curve. The Union Territory of Pondicherry has decided to shut schools for 11 days from 16th of March. After COVID-19, people have become a lot more alert about viruses and diseases, which is a good thing. At the same time, it's important to get the right information about H3N2. What are the symptoms? What are the precautions to be taken? And how serious is this virus? If you have any questions at all, and I know that many people right now are down with cough, cold, flu, simply call us. You can call us because there are 2 doctors who are joining us on this broadcast. Any questions you have regarding the H3N2 outbreak, any questions at all, do call us. Let me introduce my guest to you this evening, both doctors who you've met before on television screens. Dr Vikas Maurya is the Director and HOD of Pulmonology at the Fortis Hospital. Dr. Maurya, thank you very much for your time. Dr. Sanjeev Bagai, old friend of Mirror Now, chairperson of the Nephron Clinic. Dr. Bagai, let me come to you first. I know we shouldn't panic, but the fact is that everyone around, many people around us are unwell. How do we know this is COVID, this is the new flu, this is something else? How do we figure out?
Good evening, everyone. So I think the most important thing to understand is that both COVID-19, which was ongoing and it's still seen in some parts of the world now, although at a much lower ebb, and indeed the influenza type A are RNA viruses. The initial 1 to 2 days, any viral presentation is exactly the same. So let me quickly highlight what are the key differences, at least from a clinical standpoint point of view, which can differentiate between what we call as a flu or indeed the other vertical being common cold versus the previous COVID-19. Both the groups basically have fever, cough, sore throat, headache, runny nose, a little bit of breathlessness. But the highlighting feature of flu is that you don't have so much of gastrointestinal symptoms like we had in COVID. There is no loss of smell or loss of taste, and there is not so much predisposition towards rashes or indeed sore eyes. The incubation period for COVID was approximately 4 to 5 days, going up to 7 to 10 days, whereas this influenza is a much shorter incubation period, just 1 or 2 days. The duration of the illness of influenza is much shorter, between 5 to 6 days, most people recover, whereas COVID-19 can last for weeks up to months, and indeed long COVID, almost 20-25%. The real message is that the presentation of all virals are exactly the same. Do not self-medicate, take rest, proper hydration. The key point is wear a mask because it works as well for COVID as for influenza. Isolate yourself, do not take antibiotics unnecessarily, just symptomatic treatment, and almost all cases recover completely.
Dr. Bagai, you're saying almost all cases recover completely. But Dr. Maurya, is it true that for the H3N2, you recover within 6 days, 7 days, and then it comes back to haunt you as well? That it takes a long while to recover. It may, the symptoms may go away, you may be feeling better, and then it comes back to you.
Yeah, I think one thing which I want to say is that I started noticing this, change of, virus in October last year. When even in November, when it started increasing more, I, contacting the people, I said that there is a change in the pattern of, the virus. I'm finding more of H3N2. Then again, in December, I was finding, many patients coming at, because, I made the protocol in November only last year. that all patients coming to, with respiratory symptoms, we will test for, for influenza as well as for COVID. So what we found that, to our surprise, it was more of H3N2 and very, very less of H1N1, and very rarely we are getting, COVID patients. But then in January, we found a peak. Many patients were coming to us with, possibly with the, H3N2 virus. So what I found is that, majority of these patients were having, they're coming in the OPDs with, milder symptoms. Mild symptoms in the sense not requiring, hospitalization, but they were having fever, which was high grade, 103, 104 Fahrenheit, and then having obviously respiratory symptoms like throat irritations, throat pain, and then having cold, then, having, fever going on for 5 days, 6 days, and then leading on to post-viral bronchitis. So what I found that, in these patients, post-viral bronchitis was quite longer, which people say, yes, now I'm having cough after, 8 days. So that was basically the post-viral, the bronchitis. Then what I found, other thing is that many of these patients were also getting admitted in the hospital as well, and few patients requiring, even the ventilator as well. But all patients came, they became well and were, sent home, in around 5, 6, or 7 days, even after admitting in the hospital. So yes, majority of the patients were requiring, ICU care, which I found were, elderly, and these were most immunocompromised. I mean, patients with, having risk factors like, cardiac risk factor, or, having some sort of immunocompromised disease. So these were those patients who were very, very, elderly or immunocompromised patients required, ICU care with involvement of lung as well. And when we did the testing, they came out to be, H3N2 positive. But yes, all patients came out very well. So we should not fear about this, as if we had a fear of, COVID-19. I was a COVID in charge. So I, since then I'm following very, very, carefully these patients. All my respiratory patients are always, they're getting admitted. I test for flu as well as for COVID. So that was the pattern which I saw. But I found, that all these patients have come out very, very well. So no need to panic. Just as has been said by Dr. Bagai, that we should,
no need to panic, you are
do the
saying?
symptom treatment. Yeah. And only, if the symptoms, increases, you should.
We'll talk about the treatment. Doctor, we'll talk about the treatment in just a bit. We have a caller with us from Delhi. Anita is calling us from Delhi. Anita, please go ahead.
Hello, Dr. Bagai. My question is for you. Number one, does it affect tonsils?
Okay, and do you have a second follow-up question as well? If you do, then we can, get Dr. Bagai to answer both.
Okay, my first question is, does H3N2 affect tonsils or the lymph nodes? Okay.
Question. So when you talk
Dr. Bagai, please go ahead.
Yeah. When you talk in terms of a viral infection, generally the upper respiratory tract in influenza is always infected. Tonsils are rudimentary lymph node tissues which are at the back of your throat. Mostly in adults, they are extremely small and they don't cause major problems. Tonsillitis is seen more often in children, but yes, it can affect the tonsil areas. But COVID, in fact, is a reservoir in the tonsils, which has been proven in large multinational studies, much more than influenza. But yes, influenza affects mainly the upper respiratory tract. If you have comorbids or if you have an ongoing pre-existing medical condition, then it can also involve the respiratory tract. But like I said earlier, by and large, a large majority of patients are transient and they have a course of self-recovery.
Dr. Bagai, can I just ask you what the treatment protocol is here? Of course, not for a moment, am I asking viewers to self-treat themselves or self-medicate themselves? We know that Indians love to do that. The kuch hua, they'll say, haldi ka pani pee lo, or just start taking paracetamols, etc. So I'm not encouraging that behavior, but I want to know what the treatment protocol for influenza is.
Okay, so just let me break it down into very, very simple language for everyone. When we see a patient with upper respiratory symptoms or indeed a cold cough, what we call as coryza, runny nose, fever, headache, or any other body ache or myalgia, the clinical picture in the first 2-3 days is exactly the same for almost all illnesses. We go clinically. if we start investigating each and every patient which is coming into the outpatient department with huge amount of extensive laboratory tests, it becomes counterproductive. If a patient has high-grade fever for more than 48 hours, if the patient has loose motion vomiting or any breathlessness or rash, yes, we investigate. If the patient is not recovering with just paracetamol symptomatic treatment, yes, we investigate. The treatment, we have antivirals, and indeed it's been used even in the past pandemic. But the real issue with H3N2 is that the present generation of antivirals may not work as well as what it had worked for H1N1. We also have the regular annual flu shot, which works very well. It has an efficacy of 43 to about 70%. It should be recommended to children and to the elderly, especially with comorbidities. But the most important critical feature is do not self-medicate. Only paracetamol as symptomatic treatment. Hydrate yourself well. There is no role of antibiotics. Please do not take medicines like aspirin, nimesulide, ibuprofen. They can harm the body in terms of causing more GI symptoms and altering the platelet function. Just take rest. The key is isolate yourself so that you don't transmit it to other people. Masking still becomes important. It is the most important barrier for ingress and egress of infection.
Okay, but Dr. Vikas, who needs to mask? Do you need to mask up if you're showing symptoms? Or does everyone who's stepping out in public now needs to mask up?
See, I mean, those who are having the symptom, obviously they have to mask up, and those who are, elderly patient, those who are immunocompromised, those who are high risk, individuals, obviously, for example, transplant patients, they need to mask up so that they don't acquire these, infection. And obviously, as said, earlier, all these patients really require symptomatic treatment at all. No need to panic. Only those patients who require hospitalization, they are usually we recommend them antiviral along with the management of other signs and symptoms. But yes, as you said, mask is only obviously at the moment only recommended for those who are who are high risk cases. That I would recommend at the moment. Yeah.
Okay, we'll leave it there for the moment. Dr. Vikas Maurya, thank you very much for joining us. Dr. Bagai, thank you very much for joining us. It was important for the two of you to come and speak about something that people are worried about. I'm fairly certain no one is panicking at this point of time. We've seen 2 years of COVID. Now we know we are prepared for anything. But it was important to, at least get a clear understanding of what this new influenza is and what we need to do with it. We'll leave it there for the moment. Thank you very much. I'm slipping into a quick break on the show. There's much more news on the other side. Do stay with us.